and we are honored to have a real superstar here this evening to give us a preview of what he is going to be speaking about at our annual Functional Medicine Conference that will take place March 6th through the 9th in Atlanta, Georgia. And we're anxiously looking forward to it. And we are very excited about all of our faculty members, but we are especially excited about Dr. DeSilva, who is here this evening. If you're looking at your screen, you can see this handsome man that we have featured here. And Dr. DeSilva is a practicing internist at the Raritan Bay Medical Center in Perth Amboy, New Jersey. He is also on the teaching faculty at the JFK Medical Center in Edison, New Jersey. Dr. Silva has lectured on various topics in medicine, nationally and internationally, and is a member of the AMA, the Society of Internal Medicine, and past president of the American Nutraceutical Association. He has his own radio talk show called Ask the Doctor, as well as his own television show, To Your Health. Dr. DeSilva has also authored and published 2 books, the first, Coping with Lyme Disease, and the second, Ask the Doctor. He also has hosted medical segments on CNN and appeared on numerous national television programs, including ABC's Nightline. Dr. DeSilva was honored as one of the best doctors in the New York metropolitan area from 1996 to 2008, and he has received countless awards for his excellence in the field of functional medicine. Now, Dr. DeSilva sent me that bio, and believe me, he is being modest. I have known Dr. DeSilva for a short while. I heard him probably a year or two ago, and again, I invited people to be a part of our faculty. I invited the lecturers that I enjoy listening to, and I thoroughly enjoyed his lecture. I think it was about how all medications will deplete you of some type of nutrient, and I found it very fascinating. So he was one of the first people we thought about when we were looking for faculty, and again, we are happy to have him being associated with the American Functional Medicine Association. So Dr. DeSilva, I'm going to be quiet, and I'm going to let you give us a little taste of what you'll be speaking about in March.
Well, thank you very much, Dr. Taylor. It's a pleasure to be here, and I thank you very much for that very kind and very nice introduction. My topic that I'm going to be discussing in March is going to be the implications and impact of polypharmacy on aging. The lecture that you heard me do was a drug nutrient depletion lecture. For the past 20 years, I have been working in the world of integrative medicine, and actually, as you said, I teach at JFK Medical Center in Edison, New Jersey, and I'm on the senior attending staff at Raritan Bay Medical Center. And my principal role has been to educate the physicians and educate the students and the residents on this whole area in the world of integrative medicine. I've always believed that in order to work in the field of medicine and practice in the field of medicine, you really need to pull from various entities. You know, I have never believed that one teaching or one philosophy has all of the answers. So I've always believed that, you know, we need to take something from the Eastern medicine, we need to take something from Western medicine, and we need to be able to integrate this concept into the way we deal and we interact and treat our patients. You know, somebody comes in to see us that has back pain. Okay, we need to do the MRI, we need to do a CAT scan, we need to do the x-rays, we need to do what we need to do in order to make a diagnosis. But after that diagnosis is made, that's where we as clinicians really play a role, and especially we as integrative medicine clinicians, functional medicine clinicians play a role. You know, if somebody comes in with back pain, you know, I want to make sure that their vitamin D level is good. I want to make sure that they're on the appropriate omega-3s. I want to make sure that they get introduced to acupuncture. I want to make sure that they have some massage. I want to make sure all of these things are working for them in order to give the patient the best result or therapy. So this is the way I've been working in the field of medicine. This is my 26th year in the world of integrative medicine, and I've been doing this my entire career. So as I was thinking about all of this, and as I've been speaking at a lot of the age management, I don't like to use the word anti-aging, but the meetings where we deal with functional medicine, where we deal with age management, what I came up with was the idea of there's a reason that we all age, and there's no way that we are going to stop this aging process. Now, I will be 57 in 2014. In early 2014, I'll be 57 years of age. I'm still extremely active. At this point, I'm taking no hormones. I'm taking no testosterone. I'm taking no growth hormone. I'm taking none of that stuff. I am purely doing everything I'm doing right now with diet, exercise, and supplements. And if anybody wants to take me on in tennis or any other physical sport, happy to do that, because I know my levels are optimal because of what I'm doing today. Without the hormones and without the testosterone and without, at some point, and I tell people this all the time, at some point, maybe in my early 60s, okay, maybe I'll need some testosterone. Maybe I'll need some growth hormone. But right now, I don't need it. And I know I don't need it. So, because I check my levels, et cetera, et cetera. And this is where I am. So I thought to myself, how am I able to do what I'm doing at my age when I see people in their late 40s and early 50s that have testosterone levels that are 200 and 300, that have IGF-1 levels that are in the ground, that that have that have no energy, their libido's no good, they've got erectile dysfunction. What is happening to these people that is different from what I'm doing? And what I came up with are three things. Number one is the idea of aging. There's no question that prescription medications are much more prevalent than they were, let's say, 20 years ago, 30 years ago. So there are more prescription medications being used today from an earlier age than they were 20, 30 years ago. I remember when I was growing up and when I was in high school and when I was in grade school, I don't know anybody. I can't remember anybody that was on a prescription medication. Today, all you have to do is go to your children's schools or your grandchildren's schools, and you ask those children in first grade, second grade, fifth grade, how many of you are on any medications, prescription medications that are given to you by your doctor? And I will bet you that anywhere from 20 to 50% of the children in that class are using something, whether it be asthma medication, whether it be medication for attention deficit disorder, etc. That was unheard of when we were growing up in the 60s and the 70s. That was just unheard of. So prescription medications are being prescribed at an earlier age. And my contention is that because of these prescription medications that are being given and prescribed so early, the nutrient depletion, and Dr. Taylor mentioned that he heard me speak about drug nutrient depletion, the nutrient depletion is happening at a much earlier age. So my contention is that the depletion is happening earlier and the disease process is happening at an earlier age. That's number one. Number two, we've got something called oxidative stress. And we are under much, much more oxidative stress, and I don't need to explain to a group of functional medicine physicians what oxidative stress is. When I do grand rounds at my hospital, I need to explain what oxidative stress is, but I don't think I need to explain that to this group. But we're under much more oxidative stress. Our lives are much more stressful. Our cortisol levels are sustained and high for longer periods of time. Our adrenals are burnt out. We're burning out our thyroids. So that's my second thing is oxidative stress or oxidative damage that's happening to our body, again, at a much earlier age, accelerating aging. And number three are heavy metals and toxic metal uh, exposure toxicities within our bodies. We know that chlorine acts as a xenoestrogen. We also know that aluminum will poison the central nervous system. People that have high aluminum levels are 8 times more likely to develop neurocognitive problems. We also know how deadly mercury is to the nervous system and also to the endocrine system. And we also know how bad silver is and damaging to our bodies. So, I've been measuring these levels. I've got some amazing technology that I'm going to be speaking about at the Functional Medicine Conference in Atlanta in March. And I'll be showing you that technology along with describing how these heavy metals play such a critical role in damaging our body and fooling our body into believing that these are xenoestrogen-like compounds. So for all of you out there that are trying to give your patients estrogen, progesterone, testosterone, especially estrogen, and it's not working, and you say to yourself, why isn't this working? Why is this woman gaining weight, and why is she telling me that she feels so terrible? Well, I had the same problem over the past many, many years, over the past decades, in fact. And I finally figured out that it has to do with the heavy metals in our body. There's no place to bind. All the binding sites, all the receptors are taken up by these heavy metals. So now we've got a triad. We've got a triad of nutrient depletion, we've got oxidative stress, and we've got the toxic metals in our system all impacting aging. And just to give you some statistics, 20% of the U.S. Population of patients are found to be on 5 or more prescription medications. This was reported in the Mayo Clinic in just this year, 2013. 70% of Americans are on at least one prescription drug, and more than half receive at least 2 prescription drugs. Then some of the really scary things are things like the amount of sucrose, the amount of fructose, the amount of all of these chemicals that are in our drinks today. And then the nutrient depletion in our food. You would have to eat a dozen bowls of spinach today to equal the iron content of one bowl of spinach served in 1930. Let me repeat that. You would have to eat a dozen bowls of spinach today to equal the iron content of one bowl of spinach in the 1930s. I wanted to share one other thing with you, and I was looking for this. Toxins, the toxins, how they damage and how they destroy our central nervous system is just absolutely frightening. The dysfunction on cellular levels and the dysfunction of the cells is, again, absolutely scary. When we look at all of these things and we look at the depletion of the food and we look at the depletion of the nutrients, I was just reading as I was waiting for the conference to come on, JAMA, Journal of the American Medical Association, December 11th, 2013. This is on page 235 of JAMA. Proton pump inhibitors and H2 receptor antagonists use and vitamin B12 deficiency. And what they report here, proton pump inhibitors and H2 receptor antagonists suppress the production of gastric acid and thus may lead to malabsorption of vitamin B12. Folks, we know how critical vitamin B12 is. I said many, many, many years ago that there was a direct correlation between the over-the-counter proton pump inhibitors and H2 receptor antagonists. I said this 10 years ago, that there's a correlation between them and heart disease. And you know what? I figured this out 10 years ago because the depletion of vitamin B12 contributing to the elevation of homocysteine and the destruction on the cellular level, on the intimal level of the arterial system, because homocysteine has a shearing effect on blood vessels, and that is where the problems begin, an acceleration of cardiovascular disease. Folks, this is all related. And for me, it is so important and it's so critical to pay attention to the drugs that we're giving our patients and to make sure that you're replacing the nutrients that are lost from these drugs. I'm going to be going through all of these, the major categories of drugs at the conference, talking to you about the nutrient depletions and what we can do about them, and along with showing you some brand new technology. And I had the first machine, the first scan in the United States that was able to pick up mineral deficiencies, 15 mineral deficiencies, and 12 heavy metal toxicities. I have the first device that's able to pick this up by using something called a spectrophotometer. It literally takes 60 seconds to do the test. You get the result immediately, and I'll be showing you this technology in March when we get to Atlanta. So I'm looking forward to seeing all of you there. I thank you very much for your time this evening, and it's been a real pleasure. And Dr. Taylor, thank you once again for allowing me this opportunity.
Well, thank you so much. I love a good tease, Dr. DeSilva. And, you know, that's
we're
how you
taught
do
to
it.
do that on radio and TV.
That's right. We can tell you're a media star. You left us with that tease. We got to come now. So that's exactly what I needed you to do. So I appreciate it. And, you know, I just want to say, you know, as being an OBGYN, you know, I got started down this road because I didn't understand estrogen and progesterone just in the basic physiology. And I got really, you know, into the hormones and speaking about hormones. But I quickly realized that hormones are a minor issue. They're great,
yes.
But I always say no one ever died of a hot flash, and no one ever died. There may be some husbands that died of PMS, but no women died
that's a difference.
of PMS. Yeah, exactly.
They were killed. They didn't die.
Exactly. They didn't die from the PS. They were a victim of the PMS. But, you know, when you talk, you know, then I began to understand stress and cortisol and neurotransmitter imbalances and GI problems and nutrient deficiencies and how the mitochondria makes ATP and all of that. And that's so much more important. When people come to my smaller seminars that I have, I said, if all you came here for is to learn how to slap progesterone on people, then I'll give you your money back and you need to go. Because you cannot stop there. And once you open up or take off those blinders, then you can't go back. I mean, you got to keep going, and you got to understand heavy metals and all of this stuff. So that's why, you know, we have to think on a broader level. And I enjoyed hearing you speak, and I can't wait till March. You really, anyone who's listening out there, you'll miss a treat if you miss Dr. DeSilva. You can tell he's a brilliant guy, but he knows how to speak on a level that any doctor at any level of traditional medicine or functional medicine will be able to understand it and will be able to get something out of it. So, again, thank you for your time, Dr. DeSilva. I know you're a busy guy. We appreciate all of your participation in this. And, again, we'll let you go and eat dinner or whatever. But, again, thank you so much.
Hey, thank you so much, and a very, very happy and a very blessed holiday to everybody listening.
You too. All right.
Thanks
again.
Take care.
All right. Bye-bye.